So I want to thank Marla and the panel. And the questions that you just asked are excellent questions that actually feed right in to the next session, the next couple of sessions. And then there's a half hour at the end where I'm supposed to summarize everything, but that's really where we're going to have a conversation and where we continue to get questions and ideas. So again, thank you to the panel that we've just heard from. Great start to the morning, a lot to think about. And I now would like to ask Akiko Maeda from the World Bank, who will be moderating a panel, the first of two panels that are going to talk about impact and insight, innovative partnerships. So you see why these questions fit right into the next panel. So save your questions because we will have some time both in between panels and at the end for discussion. And you're moderating a virtual panel. Yes, so speaking of new technology.
Yes, good. Thank you very much. It's a great privilege and an honor to be able to participate in this discussion. My name is Akiko Maeda. I'm with the World Bank, and I'm coordinating our work on health workforce related to our commitment to supporting low and middle income countries achieve universal health coverage. We find this as a critical component of our overall global strategy to eradicate extreme poverty, but we also want to boost shared prosperity. That's the new language we're using. We want to make sure that we make it clear that the World Bank is moving towards a different paradigm. We have been for at least the past decade or two, but there's a perception that somehow the World Bank is pushing economic growth for the sake of economic growth. And we'd like to make it clear that that is not our priority. Our priority is really the notion of shared prosperity, and our attention towards 2030 is to ensure that the lowest income group, the lowest 40% income group, that their social welfare and economic opportunities are expanded faster than those in the upper quintiles and other groups, so that the gap, the income gaps, opportunity gaps are narrowed by 2030. And as part of that, we see universal health coverage as a critical and essential element. And of course, within that, the health workers are especially important, and being able to address the needs of the nursing and midwifery cadres and their critical role in achieving this is very, very important part of our overall strategy. So today, I'm very happy to be able to have two of our colleagues who are actually in the field, and I'd like to thank them for, especially for our colleague in New Delhi, Somil, who is it's at dinner time that he will miss, and our colleague Dr. Kamarogo, who lives in Nairobi but actually is right now in Niamey in Niger. I'd like to start and introduce Dr. Somil Nagpal, who is our senior health specialist in New Delhi, and he's leading a lot of our work in India. India, with the new government, has committed itself to universal health coverage as one of its important goals. But we have many challenges, and we're looking for different ways to address this. Somil is very much involved with the government of India in discussing ways forward on achieving universal health coverage. So what I hope he will be able to present today is an example, concrete example of the kind of work we do at the World Bank on investing in a very specific project. I'd like to mention that Somil has both medical and management background. He has an MBA as well as a medical degree. And so I think he's very concerned about bringing forward the business model, business approach. But as a World Bank, we're also a public agency, so we work a lot with the governments, and how can we bring these different groups together in order to achieve better results. So I'd like to turn to Somil and to ask if we can we manage to get his presentation on the screen?